For my evidence-based practice video, I decided to do a qualitative study. And the title of the article is a qualitative study of factors facilitating clinical nurse engagement in emergency department catheter-associated urinary tract infection prevention. The article was written by Ellen Carter, PhD, Daniel Palin, MD, Leslie Mandel, PhD, Corinne Sennett, MA, Jeremiah Skur, MD. They published on October 2016. This article, I chose this article because I was doing urinary catheters a lot, and I was just wondering why we put urinary catheters in so much, if there's anything else that we could do besides urinary catheters, and what are the risks of urinary catheters. In this article, it talks about how we need to stop putting urinary catheters in so much, find alternatives, and what can we do to prevent urinary tract infections. So for the population, this article targeted patients admitted in the emergency department. The interventions was to not place unnecessary urinary catheters and find an alternative replacement. They conducted focus groups and semi-structured interviews with participants, where the focus groups were conducted during site visits, while the interviews were conducted by the telephone, and in some cases during the site visits they would do in-person interviews. For the comparison, this study compared putting urinary catheters in consistently, even if the patients did not need it, and the reasoning behind it to find alternatives for urinary catheters, and making sure the nurses know that it can cause potential harm to the patient who is already sick and is being put at risk for another infection for the conveniency of the nurse. The article stated that a lot of times that urinary catheters are put in for conveniency of the nurse, where the nurse doesn't have to worry about the patient peeing so much, and they don't have to worry about the patient going to the bathroom. For the outcome, it found that the nurse leaders, the administrators of the nursing unit, they were in charge of making sure that clinical nurses were adhering to going to these CAUTI prevention programs, and making sure that they were up on education for the technique of putting in urinary catheters. There was numerous possibilities of what we could do for alternatives for urinary catheters, such as unisex urinals, to develop new workflows such as two-person insertion technique to prevent the chances of for urinary infection or breaking sterile field, and discuss avoidable urinary catheter orders with physicians. So if the nurse saw that there was an order for urinary catheter, but the nurse believes that we really don't need one, that the patient can do other alternatives and decrease that risk of a urinary tract infection, they should talk to the physician and let them know, like, hey, I don't think that a urinary catheter is called for at this moment. Could we try something else? During this outcome, they based their results off of 52 interviews and 9 focus groups. Just 9 focus groups were analyzed across 6 enrolled emergency departments. The specified time period was from September 2011 to June 2012. And this study was done in emergency departments with high-performing CAUTI prevention programs, half of which had been achieved by magnet status. So this wasn't really based off of those emergency departments that don't have access to programs consistently for urinary catheters, and that don't benefit as much as these hospitals did. But I believe that we can truly stop urinary tract infections by just not putting in urinary catheters as often, and us constantly trying to find alternatives for urinary catheters. And that is my evidence-based practice video. Thank you.